for folks that are kind of just joining in or listening in after the fact for our review today, which is session number 6, if we can believe it, of the CA Core Plus review from the community baseline perspective of particularly closing out particularly closing out patient and starting on practitioner. So just as a little bit of housekeeping, I think we have Elliot on the line. He's going to be doing some scribing for us in a minute here. I guess he's still joining, but we've been trying to capture any of the feedback that we are going over as a group separately on an Excel sheet, which I guess I'll put that in the chat as well. And this kind of represents kind of our live version of the document that will be shared and submitted as part of the ballot feedback. So if you want to follow along for that particular and like look at how things have been phrased, that can be available through the link I just put in the chat. What I've got on the agenda today, and I know there's one kind of add in last minute. I'm looking for Joni on the call because we had discussed 2 sessions ago. Perfect. We've been talking about patient contact relationship versus role, and we'd captured some feedback around aligning to decisions that were being made, particularly by like the patient administration working group and kind of FHIR in general around how to handle separation of this concept. So Joni has another update coming out of those conversations that I've got at the first part of our agenda today. We had one outstanding question that we hadn't made a decision about whether or not we wanted to provide any requests for changes or kind of asks to modify or remove the descriptions for one of the last elements that we discussed on the last session. I'm hoping that today we can kind of focus around whether or not we do want to actually submit a change request rather than worrying about so much about what the modeling might look like in the future. I'll talk about that in a little bit. And then we will be starting practitioner. So the only other item on the agenda that was a follow-over from last week is just to confirm that, and I think the announcement is out already. If it isn't, it's coming out very shortly, that the extension has been accepted, and that for any folks, our community or any individuals and other organizations that are submitting feedback for the CA Core Plus 0.1 as part of the ballot period for submitting feedback is going to be pushed to allow for submissions up until March 8th, which was our requested deadline. So that's just kind of an administrative closure, but you will see the announcement on InfoCentral forums shortly if they aren't already cross-posted. So with that in mind, Joni, I'm going to pull up the kind of the framing piece. I'm not going to repeat it, but effectively, there was discussion about modeling for 2.
Can I share my screen? Because I've done up some slides for this.
Perfect. Okay. Yep.
I presented them internally at Chi-Hi as well. Where's the share? I think you need to make me a host.
Oh, let me do that. All right. Joni, you should be getting host privileges now.
All right. So at the working group meeting, I think it was in the PA session, they talked about this role versus relationship. So the current state is that contact has relationship, but there isn't a separate element to contain the patient role. There's a ticket that was out there. The ticket is a bit misleading as to the resolution, but patient contact lists guardian as a use case, but code system doesn't include the code for guardian. And then the proposed HL7 resolution to that ticket is the patient contact relationship currently includes a value set for contact role. Rather than expanding the value set to include relationship, they're going to create a new property to contain the contact role, and they're going to update the value set for the relationship. And that new property for the role, they're going to create a backport extension so that it can be used in previous versions. So then there's some more details about what they're going to do with relationships. So they're, for both the role and the relationship, they're going to update the binding to preferred instead of extensible. For relationship, they're going to update the value set for the binding. And they're gonna update the definition to indicate that it's about personal or professional relationships, not functional relationships. I think this will actually change to just personal relationships. And then for the role, which is gonna be a net new element, they're gonna bind it to, basically what's currently being bound, but I think they've got a different value set that's a bit more extensive. And that they're gonna add guidance that it's functional roles. And it's gonna be part of R6, but an extension is gonna be created so it can be backported. And then another thing that came out was that they're going to add a patient contact rank. So we have ranking at the telecom level, patient contact telecom, but now they're going to add a rank at the patient contact level. So if my sister and my husband were both listed as emergency contacts, there could be a ranking that says call him first and her second.
Which applied to a separate item that we had logged feedback on in terms of being clear in how rank should be expressed. This would potentially be movement in the direction towards what's being modeled internationally, right?
Yeah, and I see Lorraine has her hand up. Or
sorry, I'm fighting with mute. Yes, this is actually really good and really clear. Thank you, Joni. Is it possible that we can share the slide deck outside of the recording with our teams? Because it's just well laid out.
I can, I'm just waiting for it, because I've also in here got some proposed solutions for the Pan-Canadian Data Framework and for fire profiling. I just have to get I need to get permission before I share it out in its entirety.
Yeah, but just the piece about what HSM has done, it's very clear. It's useful.
This piece is actually in my report out for my working group report out that we talked about on Tuesday at the meeting, and Ron said he was going to share that out. I just basically took it and fleshed it out to make it a little easier to follow.
Okay, yeah, I haven't gone looked at your one from the Canada Community yet. Sorry about
that. And that was all I have on this. But I think it really does address what our concerns are. And given that it's extensible, we could probably do something in the CA core modeling, because the relationship part isn't going to change until R6. But because it's extensible, we could do some sort of invariant that precludes all the stuff that's in the extensible and do an alternate binding to the one that they're going to be moving towards.
The extension, not extensible, right? And actually, any new element in fire can be referenced to standard extension to backport. But yeah, this is useful.
You're sounding like you're in the distance, Lorraine.
Is that better?
Yes.
Much better.
Okay, so I was clarifying the difference between an extension and an extensible binding. So this is an extension.
Role is going to be an extension, but the relationship right now has an extensible binding to a value set that contains roles.
Yes, but your note said it was going to go to preferred.
Yeah, it's going to go to preferred, but it won't be preferred in R4, right?
That's true.
So
yes,
if I can share my screen, Joni, I'll just kind of recap
absolutely, I'm done.
Sat with. You might have to give me host privileges back.
Oh, okay. Give me a second. Stop sharing, and then.
Oh, actually, it's going to let me do it now too.
Yeah.
Perfect. Okay. Can you folks see, I've got on the right-hand side, our Google Docs that has our comments specifically to this point from the last time around kind of decisioning. And I don't think anything, Joni, you've provided in the update necessarily changes it. It just provides us with kind of further information on what patient admin is kind of looking into for modeling.
Yeah.
But where we currently sat is kind of to say,
if you look at that ticket, if you look at that ticket now, what I presented is the resolution to that ticket now.
Yep. So, and unless I hear differently, I'm not hearing that like our feedback in itself will change. Basically, we're not identifying the specific modeling within our comment. We're just pointing to the fact that we want to align to the decisioning that comes out of PA. Unless anyone is like with this update feels differently.
And I believe they did vote on that resolution.
Yeah.
15,481. I'm just gonna go take a look at it.
I'm not hearing any concerns. So that kind of closes out the update, and you can just put it in the chat, Joni, if they're, because I think the voting is just around the formality of it. But the other components of their agenda today is going to be determining whether or not in our closure of our review of patient, we do in fact want to make any suggestions to the changes in description. So specifically the most responsible provider details. So last week we kind of went back and forth about whether or not, acknowledging that we can't really do the modeling for what this would look like as part of our community review, determining whether or not we should put in feedback that would indicate whether these examples, like e.g., should be expanded for other resources, given that I think Lorraine brought up last week that there are a couple different resources being considered by implementers right now versus removing it or keeping it as is. I didn't really hear last time folks that were saying it should, like, very strongly, we want it either way. So because it was towards the end of the call, we said, we'll let people chew on it. And then we'll come back at the beginning of this call and make the ask to see, are we asking as a community for this description to be updated? So I want to give that kind of proper diligence and come back to this and see if there is, any desire to submit a request to modify or improve kind of what we're looking at for the descriptions here, given that we don't really have a lot of mapping that we're reacting to. If we don't hear, and we won't put in the change request, my anticipation is that it will largely remain the same. And I think as we chatted about in the last session, there are going to be more opportunities. This is an iterative approach. So if, for instance, there's more solidification on how some of the other implementers are looking at, describing that kind of roster modeling, and we're at a 0.2 or a 0.3 review, we can always update this based on what we know then. My understanding is just that this is still an ongoing discussion for a lot of our Canadian implementers.
Yeah, I don't think there's anything wrong with what we've got there. The only question is if we want a broader examples, and I can live with it the way it is. So, unless there's other suggestions, I'm happy leaving it as is.
Can anyone not live with it the way it is? Okay. Kind of what I expected, but I wanted to make sure we had time for it. Are we comfortable then moving on to practitioner? Is anyone not comfortable? I start using these. Is anyone not comfortable moving on to look at practitioner? All right, practitioner it is. So I have the practitioner profile pulled up, and I'll just recap. So our approach for patient has been, we start with a review of essentially the elements that are identified as having obligations and any further constraints that are applied in the profile. And we compare and just take a quick look at what's in the CA baseline and confirm that the CA baseline kind of rules are met or exceeded. And then we kind of take a look at, what has been identified as having obligations, because these do exceed the expectations of what's in the CA baseline today. And then we move on to talk about mappings. So kind of in the interest of following that approach, I'll pull up this. So this is our general profile. Can everybody see, like, on the right-hand side, we've got the baseline general profile. We do have a practitioner registry profile in the baseline, but like these are the most closely aligned because they're intended to cover a broad range of use cases. And the types of constraints that we put on the practitioner general profile are largely condensed to kind of, we've got these must supports on identifier and name. There are some data type requirements for system and value that we typically apply as an identifier data type. There aren't any cardinality constraints right now applied in the version of the core that we're looking at. And I think there is one, taking a look. Oh, an invariant that we can compare against. So when we've done this comparison in the past, the things, because the core isn't using must support currently, right? We're first starting to kind of try to express these with obligations. What we typically look for is we kind of expand out practitioner and look at what is being expressed here. So there is an expectation in the core that you be able to support identifier, and in the, in the baseline to support identifier. And if we look at the kind of can send expectation for senders and no error expectation for receivers, so these actors, right? We're pretty well aligned to just kind of generic support identifier. The core extends this and goes further, basically saying there's also an additional expectation to support slicing, like certain slices of identifier. So the national provider identifier and registration identifier and billing identifier, and those are expressed up here. So when you see this kind of the slice name here, what that's essentially saying is there's this expectation for can send and no error for contents that will match those slices. These slices will become much more defined as we have more cardinality and we have terminology that comes out. But for now, they're kind of these placeholders to kind of give us an idea of what some of the underlying expectations will evolve to. Lorraine, you had a question? Oh, you're on mute. Yep, go ahead.
Yes, I know I was struggling with the mute button, it kept disappearing. So when we're saying can't send, that means that we have to have code that enable us to send those particular identifiers. And I question whether, well, I'd like to look at the definition of registration. I particularly question whether billing is universal enough to enforce a can send obligation on it.
That's a good point.
If we're looking at pure clinical systems, they may not send billing identifiers.
So let's circle back when we get to the definitions to each one of these, because one thing that I think is really valuable as part of these reviews is to talk about like whether or not this is the bar, like there are issues with this bar as we understand it. So it's not just to look at the modeling, but also to say, are there some of these that we might have to say, if you're going to send it, here's what it should look like, but we don't have the expectation that every system demonstrate they can supply it. So that's a really good point, Lorraine, and I'm tagging it for a feedback item when we can review the data elements below. But closing out the kind of, when we're looking at the one-to-one baseline and identifier, I don't anticipate I would anticipate that the identifier expectation in the baseline is met. Would anyone feel like that underlying expectation wouldn't be met? That we would want to kind of convey different, like that as a change request or a consideration? And then we'll go to name after that. Okay. I just want to make sure people have the time to respond if they do. For name, that's the next place that we're looking at. We have a must support and an expectation that given and or family and or DAR be present. And when we look at name here, we have name that's identified below. So that's a can send no error. So matching our kind of foundational must support expectation. And the expectation is that like specifically, let me see one second. Text, family, and given are going to be modeled. There aren't can sends that are associated with one or the other of these individually yet. But this is a place where it's something that we still need to discuss from a core perspective, whether or not the kind of invariant should be placed in the next round as well. Given the fact that we haven't really touched on cardinality yet, it's not in place, but I just want to raise it for folks that are reviewing it to say, okay, just because we're not seeing any cardinality restricting items here doesn't mean that they're not going to be there. It's just that we aren't applying cardinality or presence rules until the next round. I think as part of our review, one of the things we can do is just acknowledge that. But is there other things that folks would want to kind of dig into from like a comparison standpoint on name? Okay. The only other things I was just going to open up just so people would see. So there is some profiling on address and extension, but for the most part, there's like, they're not constrained. So they're socialized, right? With some like comments and information. There's a preferred extension here, but there isn't a must support or a cardinality applied in the baseline yet. It isn't identified yet in the model that we used from November. But that would be the only other thing I think that is like comparative from a differential view
Yeah.
that we could look at.
On name, I was being quiet, hoping other people had feedback. So the fact that text is one of the choices in the CA core means that based on what we have in the baseline, they would be non-conforming because we're talking about family given or DAR, and we don't allow for just text. So we might want to consider, and I think we probably want to list it and park it, whether the baseline should loosen up to allow text.
I think that's a
Because
good,
right now the baseline is more constrained for name than the CA core is.
so Lorraine brings up a good point, which is as part of kind of these types of reviews, we also have to kind of consider the other direction. I think there's still an outstanding question that's evolving from the framework about whether or not name text as a pattern is going to be consistently expected. If from a baseline perspective, we said, well, we really cared about the structured pieces and we said they had to be present. This would be a chance for us to express those as feedback on, you know, what could potentially evolve to say either. So if we felt like we made the constraint the right way, we have the option of either saying, this is something for the core to consider strengthening, or the opposite, which is to say, we should consider loosening from the baseline perspective if we think we were too tight, and we do anticipate that there are going to be practitioners that are expressed with just text. Are there folks that feel one way or the other about how we would capture this and what decision we might put forward from a CA baseline community perspective on the recommendation? Or I think, Lauren, you said we could park it, just acknowledge it.
I think one or the other has to change eventually if we expect that the core is conformant to the baseline. I don't know if we expect that or not.
That is the goal of us moving towards trying to especially using impose. And I think it's going to be clear when we start putting in cardinality, but the underlying goal is for them to be aligned. So what are folks preferring? Something that we raise as feedback, or something we kind of note, but maybe note for reviewing in the next round? Buy a bunch today, guys. I'll pull up this while we kind of wait, because I see Elliot's is joined. Do we want to circle back to this one, maybe chew on it for a session or two, and then decide, like, just note that we're going to come back to whether or not this still needs feedback?
So I walked into this halfway through. Name text it's a useful escape valve. We've got, you've got cases where, okay, so usually we think that we can put together a name from given family. But if there's, somebody from China, then they want it presented as family given. And so putting it in text the way they want it presented is helpful. There's also, we may be in a situation where you've got, I've got a good friend who's, I'm sure he won't mind me mentioning his name, Andrew Hamilton Wright. Is that Andrew Hamilton Wright, or is that Andrew Hamilton Wright? There's no dash in it. So if you just had it as text, you wouldn't know necessarily how to parse it into given and family. And so and then the only accurate thing you could do is just record it as text. Otherwise, you risk incorrectly identifying his last name. So I think it's useful to allow text there, even if we strongly prefer use cases or systems properly populate family and given.
So if I'm hearing you correctly, you're arguing for adding text as an option to the baseline, not recommending removing it from the core.
Yes. Yeah.
Anyone feel differently at this point? Knowing that obviously we'll probably have to have a discussion outside of our review in the baseline to talk about changing this invariant. Okay. Well, if I don't hear anything differently, I'm going to assume that like we aren't going to provide feedback to the core unless we circle back at the end. But I will note that we will come back to the invariant that's present in the baseline after we finish our review session and submission of the feedback for the CA Core Plus profiles.
Just want to point one thing. When in my work with the registries team here, we kind of had to deal with the same thing, but as long as you always present the same order each way, you kind of doesn't really matter. And as for establishing identity, whether you put like the two-part name in one field or put the two pieces in separate fields, as far as matching identity software goes, they don't care. They'll compare across as long as it's one word versus one word wherever it appears. So
Yeah,
the
and
order matters, that kind of thing. So
we might make a different decision on the registry's profile than we do on the general one. I don't know. Yeah. Probably not, but that's a consideration.
Okay. So tagging that one for CA baseline discussion, I think that there probably isn't other comparative points for us to go through because at this point we don't have the terminology or further like cardinality expectations. Is anyone uncomfortable with us talking about this next section, which is kind of reviewing for reasonable expectations on the obligations? Okay, so on the obligation side, I think I talked about it a little bit at the beginning, but the idea is that the obligations will identify kind of an underlying element as well as an expectation that comes from the framework around what should be supported from a sender or receiver standpoint that would apply to like slices. So when we see this designation, what we're saying is, as the slice gets kind of further built out, the expectation is that the constraints within them are going to be part of what is expected for can send and no error. Right now, our process is that when we receive an item and we see it in the framework, specifically the data content standard portion of the framework, it gets a can send or no error expectation unless it's been specifically identified as kind of a stretch goal. So, like what that means is that we kind of we're working towards an underlying expectation that, you know, generically registration and billing and, you know, the unique provider number be supported kind of across systems, across use cases, in addition to things like name and telecom. And at this point in time, the ability to demonstrate you can capture and exchange and receive phone expressions of telecom and email expressions of telecom. And so these are usually paired. So everything we're talking about from a sender perspective, there is, I think in almost all cases, the exact same pairings on the receiver end. So Lorraine, you had mentioned, you know, registration. We can look at that from the definitional standpoint. Before we do, were there others here that we've got feedback for from this expectation outside of like the slice expectations? Okay, we can also bump back to this too. So there's really 3 here. Billing, was it registration or billing, Lorraine, that you had mentioned wanting to explore a little bit further? Well, we can also look at the definitions as well. So
It was billing, but
in particular billing, because I think some clinical systems may or may not have billing, depending upon what kinds of applications you're talking about.
yeah, Prescribe It doesn't capture billing, so we'd have trouble mapping to that one.
So billing, so there's a couple things that I'm going to come back to in a second here that are kind of NA for now. But if I scroll down to billing, let me actually just find it in here. It's unique number assigned to a provider by a jurisdiction that allows calculation of direct payment claims that are submitted under this number. So what I heard was Prescribe It was one example that doesn't typically demonstrate this. Now that you've seen this, are there other examples that we want to ensure that we're capturing as part of our feedback around the expectation that this be demonstrable?
Well, and even from a billing, it's calling out jurisdiction. But when you look at public, like community pharmacy, they have a billing number for a prescriber, but it's not necessarily a jurisdictional number. Like they have their college number, then they have a billing, like a doctor has a billing number. Like calling out a jurisdictional billing number might be too constrictive.
So Dean, would you phrase that like as a change in the description? Or
Yeah, for the billing, the change in the description, but there's also the can send nowhere. Like I said, Prescribe It does not use a billing number at all. That is something the pharmacy deals with their payers. Nothing that the like even a prescription that comes out, any prescription that's sent out in community has no billing information on it. It is just the prescriber's license number.
So does that mean that we need maybe another actor type?
I gotta think about that.
Right, like if we had an actor type for, like instead of a generic sender, like a sender non-pharmacy. And this is kind of aimed at Sheridan.
Well, okay, sorry, I'm just trying to actually make it so that we can see the next one. So that is an avenue that we have in that right now, the can send and the no error are applied very generically to servers and clients. So I think we have to capture that if under the current actor types, right? This is what is applied. We have to capture that feedback. If there are recommendations for how we might resolve that, I think we should do it probably separately, as a
Yeah.
separate line. And we can talk about what would be desirable from the CA baseline community to do that. So Elliot, I think I've got it open. Are you waiting for essentially a motion of a specific?
Sorry, I'm multitasking today and I didn't have the spreadsheet up.
I can, oh, it's in the chat. So Dean, just to reiterate, what you're framing is that the can send expectation on billing would create a constraint that doesn't exist for the prescribe it use case today.
Yeah, because the prescribe it focuses around what is a legal prescription, and there's actually very little that defines what a legal prescription is. Like they can write a prescription on a napkin that has their name, address, and the drug and the patient. Like there's like 5 elements that are needed. The rest are all kind of optional from a legal prescription point of view. So we've got to kind of limit to some of that. So when you're saying server actor, would that be like I'm just focusing on prescribe because it's the model that I recognize and trying to work through. An EMR sends a prescription to us as the hub, and then the hub forwards it to whichever pharmacy the EMR specified or the prescriber specified. Would the server actor be the EMR then? Because the hub is just a pass through. Like it's basically just whoever the sender is.
So currently, yes, the way that we model, there is an actor type for an intermediary. And there are intermediary obligations, but it hasn't been applied to any of the profiles here to date.
So server actor is sender, regardless of whatever it is, and client is just the recipient. Okay.
And we can,
So
like Julie said, we can put in feedback to say, hey, there is a need to have further delineation, but at least for right now, it's pretty generic.
Okay. So yeah, like I know that we're looking at trying to get at some point move prescribe it to be get it off of 1.4 and see what we're going to do with it then. But when we do that, that billing one will be the can send is the only one that I worry about for just being just us trying to think broader, but it's tough today. I'm actually on vacation. So.
Well, I appreciate you joining us. Let me just try to wrap this text so folks can see it. Oops.
I think I just did that.
Oh, my bad. Hold on.
You
There.
just undid that.
Yep. Any changes to this, or does anyone feel that we need further discussion before we would look to solidify this as a motion with a vote? And it's just a vote to say, this is the feedback that we want to submit on behalf of the CA baseline community. Okay. Would anyone want to abstain? Would anyone vote negative, like this isn't the feedback I'm comfortable with? I don't think this is what I would agree to submit on behalf of the CA baseline community. Okay, I think that leaves us with 0015 or 1500. So then Joni, you had a secondary item.
Do we have move in second on that?
Oh, yeah. I was treating that as Dean. Dean, did you want to formally make a motion? We'll redo
Yeah,
it.
either way, and whatever works for the group. Like I said, we're not actively trying to align with baseline, but I know at some point we're going to want to. So just trying to think of the future.
Would there be anyone who'd be interested in just seconding it to say, comfortable with this? This is the text I would say to put forward. If we don't have it, Elliot's correcting me because the practice, the protocol is actually, we do a first, we do a second, and if we don't get the second, we don't move on to the vote, it doesn't go in. So we have to have a second for us to progress, or we continue discussing the item.
Theoretically, if we want to be really strict, we shouldn't even move to discussing the item until there's a mover and a seconder. I'll second.
Okay. Then I'll redo the vote. So under its current kind of expression, the motion that's being put forward, do we have any abstentions? Do we have any folks who would vote, like, would be negative? This is not what we want to put forward. All right, I think the count is still 15-0-0. All right.
Oh. Yes is no longer sufficient, is it?
Sorry?
I saw Ezra on the call earlier. My initials are no longer sufficient. to
He
identify me.
actually, oh yeah, that's true. He's not on right now, but yeah, that will be helpful.
Hopefully his middle name isn't L.
I may have told some of you this before. I was working on a project where there was 2 Elliots, and my initials are ELS. His initials were ESL.
Just hope there's no autocorrection. All right, I'm just gonna go to bring us to 15. So, we've put in now the feedback around identifier billing. Joni, did you want to talk about the other item that you had mentioned as something that we would want to potentially discuss, or do we want to look at some of the other kind of slicing first?
I had just suggested that if we do want some servers to be able to send these, but others were not as fussed about, that we could have multiple types of actors. But that's a implementation kind of consideration.
So at this point in time, is it something that you think that we should have discussion and like capture feedback around a recommendation or a suggestion from the CA baseline community?
I'm gonna defer to your judgment on that.
So my take is that if we don't hear differently, that we've captured the idea around the expectations for identifier billing against this server actor. Unless we hear that we need to differentiate, we'll probably continue trying to kind of make way with the actors as most broadly defined until we get to a point where there is a further need to either make a decision about separation of certain profiles. So like, for example, we talked a little about registry. So a need to separate into a registry profile versus a need to express this using distinct actors, one that might be more registry focused than others. I don't know if we're there yet, or like the discussion that we're having around some of these items might point us to that's something to consider kind of in the next couple iterations. But if folks feel very like one way or the other about having that conversation now, we certainly can. It just might be more helpful to have a few more examples to throw against it.
Yeah, that's fair.
So, I mean, we can look at some of the other slices and talk about whether those are examples for that type of scenario. You know, one of them that that has been kind of listed today is the registration number. And as it's currently defined, actually, so there's something I'm remembering that Dean had mentioned earlier in the call, which is like the current kind of definitions. So we're gonna react against the current definitions. So we were reacting against the jurisdiction billing. And in the same vein, when we look at the registration, it's a registration number or suitable alternative that uniquely identifies a provider in a particular jurisdiction, assigned by a submitting jurisdiction for administrative purposes. So kind of similar in that it has a definition that's oriented around something that would be jurisdictionally assigned. Given what we talked about with billing, are there other scenarios that would come into play where this would be a challenge with consent and no error?
So when it says jurisdictionally assigned, would that include a college within a jurisdiction, like the College of Physicians and Surgeons registration ID? Because a province, if the definition means province, provinces don't issue registration numbers in most places.
So
And maybe what the change is actually is recognized by the submitting jurisdiction for administrative purposes.
Okay.
So the one thing I can add to this, because I asked a similarly, like a parallel question, which is this intended to mean medical, like is it isolated to medical licensure registration numbers? And the answer that I got is it could be encompassed within this, but it's supposed to be broader than that. And it's more any of the numbers that might be used administratively for the purposes of kind of identifying the provider within a jurisdiction. But to Elliot's point, is this something that we want further kind of clarity or refinement of the definition on? Or is that enough of an answer to sway you one way or the other, Dean?
Well, I'm just thinking like when you look at a prescription, a prescriber system, the prescriber's billing number is actually assigned by the province because they're the one paying the bill. But the registration number, which will be their college ID, like their license number, who gives them the legal authority to actually create the prescription, is the college, not the province. So like the terms and changing it recognized by the jurisdiction would clear it up and kind of get rid of that. Because the jurisdiction, from a prescription point of view, the jurisdiction ID is actually their billing number, if they're actually catching it or capturing it. But it actually doesn't go on the prescription. The pharmacies just have that on site and they use them. But it's never actually included on a prescription anywhere. I'm not even sure they can. I'd have to look
The
into that one.
question, is this supposed to be the provincial identifier or their license number? Because those are separate concepts completely.
So it could include its medical license number if that was used for administrative purposes, but the intent of the definition as it was described to me is it's actually any type of administrative number that is being used to kind of identify the provider that is active in that jurisdiction. So it would be like a Venn diagram. Medical licensure would exist somewhere within that, but it wouldn't be the isolated way of using this as it's currently defined.
It's just that assigned by the submitting jurisdiction.
Yeah, because that's the provincial identifier, not the
Well, but it
college
says submitting,
identifier.
like the province isn't submitting anything. So that last sentence is what kind of throws me off, because it's assigned by the provincial college, but it's submitted from the EMR.
Maybe it
So
should be
would
the
it-
jurisdiction submitted from.
Would it be worthwhile to kind of come up with some different use cases? Like a pharmacy, doctor for billing, like what that might help us kind of figure out where the variations are.
Yeah, to get into the other ones, we'd have to go like inpatient and acute, but I don't know what they use in inpatient. I don't know if what numbers they use there.
But looking at the name of that, it says provider provincial registration number. So that kind of implies that it's not the license number at all. Although it might have been a license number that the province is using.
Because according to this, none of these is the license number. Like there's no place
Sheridan,
to put the
is there
license,
more further down the page, Sheridan?
Yeah.
Like, is that?
because there's just the
So-
3 slices.
There is the 3 slices. There's a little bit more details when you look at like the additional information that it kind of tied to this concept. While it may not be represented on this, the idea is that you can look at kind of provider registration, provider territory, the concurrent registration numbers, registration country and status, and that they can provide a little bit more detail into kind of what the expectations of that registration is. As far as I know, there aren't further use cases called out in the attribute definitions, but like I was just looking at the time of registration or renewal, and
The one you just scrolled off, provider registration status. Oh, that's candidate for profile I just caught the words right, profile registry and practitioner registries. Yeah.
there is this one, which is registration date. So month, year in which the provider registered or renewed with a Canadian provincial territory healthcare provider, regulatory body, or professional association.
Sheridan, can you paste this page or the URL in the chat? Thank you.
So if it's confusing, one of the things that, we've done in the past is to say, and ask for further clarity or refinement for separation of concepts, or an ask to update kind of the terms to be more consistent. Like, while our goal is to kind of review from a profile level, if there are things that are changing our interpretation and how it might be applied, we are kind of capturing those as feedback that we'll kind of supply along. Do folks feel like when we're looking at the span of kind of attributes as they relate to provider registration, we have a good sense of what it means?
I think just that like the names, provider territorial registration number, they make sense. It's just that the definitions don't necessarily capture the intent of, or what I think the intent of those elements are.
Is that something you would want to put forward as as a request, or do folks want to kind of discuss it further?
I'm not ready to put anything forward as a request yet.
No.
Not personally.
And just as a reminder, we don't always, like, when I say put forward as a request, like, I don't think previously we've said it should say this, but like, I'm trying to think about a couple of them. I pull up here. We had like provide additional guidance on like separation between rank and type and use for the concept. So it doesn't always, when we say providing feedback, mean you have to supply what it should say, but if there are improvements or if there is a need for further clarification, we can certainly ask for it. So we've got kind of 2 minutes left. We can kind of come back to this, let folks kind of chew and interpret these kind of spans, and then come back to the question around, given our understanding of this definition and how it would be used, do we think the CanSand no error still comfortable with? And if there's further kind of feedback on this item, following kind of our traditional approach, what we'll probably try to do is just say, before we kind of work through the individual mappings to try to see if we can close out these pieces. And then there are some notes here that we'll probably want to touch on next time around, you know, some of the guidance around, or some of the asks for feedback around like duplicating registration numbers with licensure if they both reflect license numbers that are in use in the jurisdiction for administrative purposes. So if that approach is still working for folks where we kind of work our way downwards, then we'll reconvene and kind of start off the next session with this specific answer of like, do we feel that a change or a request is necessary for this particular item around Kensand. The homework is for folks who haven't already to take a look at the link within the chat, take a look at some of the definitions as they are, and then that will kind of help us get to a point where we feel pretty good about whether or not we have a good understanding of this concept moving forward. Sound fair?
Yep.
Perfect. Okay. Again, it's a smaller one, but I think there's some really interesting discussion topics for practitioner and that are coming up for practitioner role as well. So I think the fun is far from over for us in terms of the what we have in front of us for the review. But that will be for another day. I will let you folks off. Happy Lunar New Year. Enjoy it. Enjoy your weekends. And we will see you next Friday for our continuation of our review against practitioner.
Thank you. Thank you, sir. Thank you.